As I looked at some of the articles, it occurred to me, to use a medical term, the system's constipated.
Oh, yes, absolutely. In fact, you know, and that is one of the things that it makes it very hard. When I say that they broke up the system, for example, there's a minister of assisted living now, and that is the Minister Nixon, who's in charge of continuing care. So anything that would be ongoing care needs, whether it's home care, nursing home, all the way to full nursing home or assisted living, and that's its own silo now. But right now, currently across our province, anywhere from a quarter, 25% to 33% of our hospital beds are occupied by people that have had care, got admitted. Say, you can picture someone's grandma gets pneumonia, lives at home alone all by herself up until then. But then because of the bad pneumonia, can't really move well now, has to use a walker, can't go back to her home and needs to go to assisted living. Maybe not full nursing care, but needs some assisted living. We have about a third of our hospital capacity are those kind of patients that are stranded in the acute care hospitals across the province. And they're stranded there, I'll say, because once they get designated alternate level of care, we call it, they start getting charged. So they get actual charged for being in the hospital. And then they're stuck there and they can't mobilize, they can't interact with people. They don't do as well as they would if they were out. And because we don't have the community resources of home care, assisted living, or these long-term care beds, the solution to fix our acute care problems and the constipation, the thing to get us, you know, disimpacted and get rid of being bunged up, that lies in a different ministry now. It's fully over in a different spot of the system. And we're crying for a crisis here and saying, yeah, we're constipated. We really need to get things flowing. We got to get things moving. But the solutions are over with somebody else that doesn't feel the pain or the tummy ache or the need to go.
You referred to silos, and I'm wondering if that puts different ministries in competition with each.
It absolutely does. In fact, that was the very first thing. So I got to say, I had the privilege of being the president of the Alberta Medical Association. I was there for, through 2003, 4. I was literally there as the new minister came in, new government came in. And I was one of the first people that got shown this silo and this organization that they were going to create, break up AHS. I got to say off the get-go, was AHS perfect? No. There were lots of things that could have been improved. In the hat here, I could tell you, for example, could we have had a bit better local decision-making within the AHS beast? Could we have said, hey, this works well in the hat, let's implement this. We don't need to do what Edmonton or Calgary does. We could have improved that without blowing AHS up. Mm-hmm. But they blew up AHS. And then, and so what that set up now is once they put these four different silos now with 4 different ministers, and then we come out and say it's a crisis. Well, essentially, they set up a scenario where the minister of assisted living is not going to say, hey, yeah, it's our fault. Yes, that it actually is these patients that are stranded in the hospitals that should get out. And meanwhile, it would be the minister of hospitals is going to be, well, it's these people, it's theirs, and they're going to blame each other, right? And when the solution is to coordinate, but it even gets to where they start gaming, where we've seen a drop of about 20% of our ALC numbers. So again, ALC, I hate all the acronyms we use, and it's
like the Army.
It is. It truly is. And we have to, because it's a complex system. But that is the stranded patients. That's your grandma stranded in hospital and we can't get her out because we need assisted living, for example. Those patients are, we got a 20% reduction of them. But when you look at it, you're like, well, is that because they moved out of the hospitals, or did they redesignate a number of them and change the designation? It's the latter. They didn't move out of the hospital. They just changed some of the designations of people. So let's simplify that, and really, why would they do that? And what they did is, over in the Ministry of Assisted Living, they're like, well, we're going to look at all these people that are listed and see if they have a little bit of medical conditions, or they still have a little bit of things that are problematic that still need to be dealt with. We're not going to let you call them ALC anymore. And what that turns out to be, though, is kind of being like, well, we got my grandma who had pneumonia is better with pneumonia, but she's always had diabetes and she's always had hypertension, and that can be treated in the community. But all of a sudden, Minister Nixon and his team want to say, no, we can't take them out till you fix their diabetes or hypertension. So it set them up to compete against each other, and it set us up to fail.